Understanding chemotherapy-associated nausea and vomiting in cancer treatment. Hello everyone, I'm Dr. Gatas, Assistant Professor of Hematology Oncology. Today, I want to talk to you about an important topic that many cancer patients undergoing chemotherapy experience: nausea and vomiting associated with chemotherapy. Chemotherapy is a crucial treatment modality for cancer, but it often comes with side effects. Nausea and vomiting are among the most common side effects experienced by patients. In fact, studies have shown that up to 7 out of 10 of breast cancer patients receiving chemotherapy may experience these symptoms. So, why does chemotherapy cause nausea and vomiting? Chemotherapy drugs can affect the digestive system, triggering signals in the brain that result in these symptoms. Additionally, certain chemotherapy agents can irritate the lining of the stomach, making patients more prone to feeling nauseous. Chemotherapy-induced nausea and vomiting can significantly impact a patient's quality of life and even adherence to treatment. It can lead to poor appetite, weight loss, nutritional deficiencies, and even dehydration. Managing these side effects is crucial to ensure patients can complete their prescribed treatment regimen effectively. Now, let's explore the different types of chemotherapy-associated nausea and vomiting. We commonly classify them into 2 categories based on the timing of their onset: immediate and delayed. Immediate onset nausea and vomiting occurs within the first 24 hours after receiving chemotherapy. On the other hand, delayed onset symptoms can appear more than 24 hours after treatment and can last for several days. Furthermore, I'd like to mention anticipatory nausea and vomiting. Some patients may develop these symptoms before their next chemotherapy session due to anxiety or conditioned responses. To manage anticipatory symptoms effectively, we often include anxiolytic medications to help reduce anxiety and break the cycle of nausea and vomiting. Additionally, it's important to understand that the risk of chemotherapy-associated nausea and vomiting can vary depending on the specific chemotherapy regimen. We classify chemotherapy regimens into 3 risk groups: low, intermediate, and high. Each group requires a different combination of anti-nausea medications for effective management. In the low-risk group, patients typically require only one anti-nausea medication to control their symptoms. These medications, such as 5-HT3 receptor antagonists, commonly known as Zofran, can effectively prevent and alleviate nausea and vomiting in these cases. For patients in the intermediate risk group, a combination of medications may be necessary. In addition to the 5-HT3 receptor antagonists, we may also prescribe neurokinin-1 receptor (NK1) receptor antagonists, usually given with chemotherapy infusion. This combination has shown improved outcomes in preventing chemotherapy-induced nausea and vomiting in this group. The high-risk group requires the most comprehensive approach to managing nausea and vomiting. Here, we typically prescribe a combination of 4 different medications. In addition to the 5-HT3 and NK1 receptor antagonists, we also include corticosteroids and olanzapine, commonly known as Zyprexa. This multi-drug approach helps address the heightened sensitivity to nausea and vomiting in this group. Now, let's discuss some practical tips that can help alleviate chemotherapy-induced nausea and vomiting. Tip number 1. Make sure to drink enough fluids so that you don't get dehydrated. It's important to stay hydrated by sipping water, clear broths, or electrolyte-rich drinks. Tip number 2. Instead of having 3 big meals, try eating 5 or 6 small meals during the day after chemotherapy. This can help prevent overwhelming your stomach and make it easier to tolerate food. Tip number 3, know your body. Some individuals feel better when they eat or drink a small amount before treatment, while others find it better to avoid any food or drink prior to treatment. Tip number 4, avoid foods that are spicy, greasy, or heavy. Instead, opt for bland foods that are easier on the stomach and less likely to trigger nausea and vomiting. Tip number 5. Consider trying ginger ale or over-the-counter ginger supplements to settle your stomach. Before we conclude, I want to provide you with 5 important questions that you can ask your oncologist regarding chemotherapy-associated nausea and vomiting. Asking these questions will help you gain a better understanding and actively participate in your treatment journey. Question 1. What are the specific chemotherapy drugs I'll be receiving? And what is the likelihood of experiencing nausea and vomiting with each of them? Question 2. Based on my chemotherapy regimen, what risk group do I fall into for chemotherapy-induced nausea and vomiting? And what medications will be prescribed to manage these symptoms? Question 3. What are the potential side effects of the anti-nausea medications I'll be taking, and how can I manage or alleviate them? Question 4. Are there any lifestyle modifications or dietary recommendations that I should follow to help prevent or reduce chemotherapy-associated nausea and vomiting? Question 5. How can I effectively communicate with you, my healthcare provider, about the severity and frequency of my symptoms? Is there a specific scale or system I should use to track and report my nausea and vomiting episodes? These 5 questions will serve as a starting point for your conversation with your oncologist. By asking them, you can gain a clearer understanding of what to expect and actively participate in managing your chemotherapy-associated nausea and vomiting. Remember, you're not alone in this journey, and we are here to support you. Stay strong, stay positive, and take care. Transforming battles into victories, one patient at a time. Tharwat Gatas, MD.